Professional English in Youth Medicine, Chapter 15, Bones. A. Bones. Some common English names for bones. English name, anatomical name, skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia. Fractures. A fracture is a break. A fracture is a break in a bone. Some of the different types of fracture: green's teeth, displaced, comminuted, impacted, open, compound. A pathological fracture is fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma. For example, long-distance marching or running. Treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation. Either external, for example, or a splint or plaster of Paris cast, or internal, for example, a pin or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. A plaster cast, a pin, a plate, and screws. Note, the verb reduce has several meanings in medicine. To make it smaller, I think we'd better reduce than those of your tablets. In surgery, to return to anatomical position, a hernia can normally be reduced by manipulation. In chemistry, to remove oxygen and add hydrogen. Nitric acid is a reducing agent. Exercises. Exercise 16.1. Label the diagram using words from the box. Look at A opposite to help you. 1. Skull. 2. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Shoulder blade. 7. 8. Thigh bone. 9. Kneecap. 10. Shin bone. Exercise 16.2. Match the types of fracture 1 to 5 with the description A and A to A. Look at B opposite to help you. Open. There is a break in the skin. Comminuted. The bone is broken into several pieces. Displaced. The broken pieces are separated. Green stiff. The bone is bent. It occurs mainly in children. Impacted. The broken pieces are pushed together. 16.3. Complete the textbook strat look at see opposite to help you. Reducing a fracture involves trying to return the bones to as near to their original position as possible. In a fracture is allowed to heal in a displaced position. The fracture will unite, but it may go on to malunion. Chapter 17. Childhood. A. Milestones. Childhood is the period during which a person is a child. During which a person is a child. It ends with puberty. The onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestones in a child's development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, and talking 2-word sentences by 3 years. B. Common infectious diseases. Disease, common name. Morbidly, rubella. Measles, common name, measles. Rubella, German measles. Varicella, common name, chickenpox. Infectious parasites, mumps. Pertussis, whooping cough. Acute laryngotracheitis. Crowd. Scarlatina, scarlet fever. Rheumatic fever, common name, rheumatic fever. Tetanus, lojo. Polio, poliomyelitis. Polio. Celiac disease. A medical student has made some language notes while reading her textbooks. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Sensitivity to having a negative reaction to weaning, changing the diet from milk only to solid foods. Clinical features, the symptoms and the signs of a disease. Malabsorption, poor absorption, malnutrition, poor diet nutrition, adjective, malnourished. Thrive, grow strongly. Distension, swelling. Delight later than expected. Failure, when something that is expected does not happen. stature, size, especially height. Exercises. Exercise 17.1. Complete the table with words from A and C opposite. Then complete the sentences with words from the table. Verb, noun, adjective. Delay, delayed, delayed. Develop, development, developed. Distant, distension, distended. Fail, failure, failing. Nourish, nourishment, nourished. One baby with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to an enlarged liver. Small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of milestone may be the first sign of diseases. 70.2. Write the common English name for each diseases, using your medical knowledge. 1. Enlarged parotid glands, MONS. 2. Difficulty of opening the mouth, lockjaw, rash, and enlarged posterior occipital nodes, German measles. Paroxysmal cough with vomiting, whooping cough, papules and vesicles, first on trunk, chicken pox, cough and cold followed by rash, measles, sore throat and rash, scarlet fever, swollen joints and a hard murmur, rheumatic fever, fever followed by muscle weakness, polio, cough with a stridor, croup,